After studying this module, you shall be able to know how mental illness was treated in earlier times, learn ways of defining abnormal behavior and its underlying causes, understand classification of mental disorders, differentiate between clinical and abnormal psychology. Abnormal psychology is concerned with understanding the nature, causes, and treatment of mental disorders. We are surrounded by topics and problems within the field of abnormal psychology. Surf the net or read a book or a magazine or even watch a movie. You will be exposed to the issues that clinicians and researchers deal with on almost daily basis. Psychological disorders include stress, adjustment disorders, stress, post-traumatic stress disorder, anxiety disorders, phobias, generalized anxiety disorder, obsessive compulsive disorder, mood disorders like unipolar, bipolar, suicide, somatoform and dissociative disorders, hypochondriasis, pain disorder, eating disorder and obesity, anorexia nervosa, bulimia, sleep disorders like insomnia, restlessness, personality disorders, paranoid personality disorder, histrionic personality disorder, schizoid personality disorder, addiction disorder like addiction of alcohol, drugs, sexual disorders, gender identity disorder, schizophrenia, delusion disorders, and childhood and adolescent disorders, autism, etc. Explanation of madness always existed and have varied markedly over the period of time. As early as 3000 BC, researchers and archaeologists they have found skulls bearing the evidence of trepanning, the process of cutting holes into a skull of a living person. Researchers found the bone healed near these holes, indicating the procedure may have been surgical and that the person is survived, although trepanning is still performed today to relieve pressure of the fluids on the brain. Anthropologists suggest that in the ancient time, the holes may have been drilled into the skull as a mean of releasing evil spirits that were trapped inside the head, causing abnormal behavior. Other anthropologists believe that trepanning was used to treat medical problems like removal of tumor. Ancient times. The early citations about abnormal behavior were as explained by the operation of supernatural and magical forces such as evil spirits or the devil. The therapy generally involved exorcism, for example, removing the evil that resides in the individual through counter magic and prayer. In the West, Greek physician Hippocrates was the first to systematically explain why people behave as they do. He described the brain as the interpreter of consciousness as the body's most important organ. According to him, the disorder were due to imbalance among the four vital fluids of the body: phlegm, blood, black bile and yellow bile. Modern abnormal psychology. In 1906, Morton Prince, an American physician specializing in mental disorders, founded the first journal called the Journal of Abnormal Psychology, which till date is the foremost journal on abnormal psychology. Kraepelin, a German researcher and student of William Wundt, established a psychological laboratory devoted primarily to the study of psychopathology in around 1920 to 1926. He was the first person to place the biogenic theory in the forefront of psychiatry. He wrote a textbook of psychiatry. Whitmer is regarded as the inventor of the term clinical psychology and the co-founder of the world's first psychological clinic, established in 1986 at the University of Pennsylvania. Gradually, more psychological laboratories and clinics were established during 20th century. Many scientific journals were also started for giving information based on scientific researches that were happening. Today there are many such labs and many such more journals which help us in understanding and treating abnormal behavior. Defining abnormality. What is abnormal? Abnormal literally means away from the normal. Many definitions of abnormality have been proposed over the years, but every definition provided so far has proved to be flawed in some ways. Abnormal behavior may be defined as behavior that is disturbing, socially unacceptable, distressing, maladaptive, or self-defeating, and often the result of distorted thoughts, cognitions. Nonetheless, there is still much agreement about which conditions are disorders and which are not. Most of the definitions do have some common features, often called the 4 Ds: deviance, distress, dysfunction, and danger. This is pattern of psychological abnormality are deviant, different, extreme, unusual, perhaps even bizarre. Distressing means unpleasant and upsetting to the person. Dysfunctional, interfering with the person's ability to carry out daily activities in a constructive way, and possibly dangerous. There are many critical elements of abnormality. Social deviance. All societies have norms, standards that define the kinds of behavior that is acceptable in given contexts. Behaviors that are not in the line with the social or cultural norms are considered abnormal. Certain behaviors may be acceptable in some cultures but considered odd in other cultures. For example, in India, people eat with their hands, but in UK, cutlery is used for eating. So if Britishers saw Indians how they eat, and they might think they have a sign of mental illness, when really it's just a part of their culture. Personal distress, suffering. People suffering psychologically are considered to be indicative of abnormality. Individuals having abnormality experiences have a great deal of subjective feeling. Personal distress. OCD patients clearly suffer as they do with mood disorders. Although suffering is an element of abnormality in many cases, it is not a sufficient condition or a necessary condition for labeling someone as abnormal, as most of the personal distress could be because of the situational factors. Maladaptive behavior. Maladaptive behavior which interferes with our well-being and our ability to enjoy our work and relationships is often indicative of abnormality. Heavy alcohol consumption that impairs health or social or occupational functioning may be viewed as abnormal. However, not all disorders involve maladaptive behavior. For example, a serial killer with antisocial personality disorder may kill people, but it is not maladaptive behavior because it is the way they earn a living. But we consider him abnormal because his behavior is maladaptive for and towards society. Statistical deviation. From a statistical point of view, abnormality is an substantial deviation from a statistical calculated average. Those who fall within the mean, for example, those who do what other people do are normal. Characteristics falling beyond a particular distance from the average values are seen as abnormal. This criteria is used in evaluations of psychological abnormality. For example, mental retardation. However, genius is statistically rare but not abnormal. This tells us that in defining abnormality, we make value judgments. Social discomfort. When someone violates a social rule, those around them may experience a sense of unease. For example, if a person sitting next to you suddenly began to scream and you would probably regard that behavior as abnormal. It would be unpredictable and it would make no sense to you. Deviation from ideal. Several psychological theories describe an ideally well adjusted personality. Any deviation from which is interpreted as abnormal. Achieving the ideal is difficult. Most people are seen as poorly adjusted at least part of the time. We all are at some point strive to reach the ideal but might fall short of it, because of which theories people judge themselves to be abnormal and in need of help. Example, a person might consider themselves a candidate for psychopathology, but he or she might lack the intimate relationship with another person. Accepted definition of abnormality. According to DSM-4, it defines a mental disorder as clinically significant behavioral or psychological syndrome or a pattern associated with distress or disability. For example, impairment in one or more important areas of functioning, not simply a predictable and culturally sanctioned response to a particular event. For example, the death of a loved one, considered to reflect behavioral or biological dysfunction in the individual. To summarize, one of the most widely accepted definition describes behavioral, psychological or biological dysfunctions that are unexpected in their cultural context and associated with present distress and impairment in functioning or increased risk of suffering, death, pain or impairment. This definition can be used across cultures, keeping in mind cultural relativism. In DSM-5, mental disorders are defined as clinically significant disturbances in cognitions, emotional regulation or behavior that indicate a dysfunction in mental functioning that are usually associated with significant distress or disability in work, relationships or other areas of functioning. American Psychiatric Association 2013. In addition, the definition states that expected reaction to common stresses are not mental disorders. Causes of abnormal behavior, etiology, or the study of origin of abnormal behavior and what causes it. It includes biological, psychological and social dimensions. Abnormal behavior is constructed from a number of different perspectives. Disturbed behavior may be explained by biological as well as psychosocial factors such as negligent upbringing, by traumatic experience, or by inaccurate social perception, or by too much stress. Each of the following models tell us something about different aspects of a multifaceted group of mental disorders. The biological and genetic perspective assert that mental disorders are disease with behavioral manifestations and symptoms of mental disorders caused by factors such as neurotransmitter and hormonal imbalance in the brain, genetic vulnerability, constitutional liabilities, brain dysfunction and neural plasticity and physical deprivation or disruption. Today, a less extreme version of the biological point of view has emerged, which is known as the biopsychosocial viewpoint, with emphasis primarily on biological causes only. The psychodynamic perspective, founded by Sigmund Freud, assumes that abnormal behavior arises from unconscious psychological conflicts originating in the childhood. The unsolved conflicts lead to neurosis, disturbed behavior involving anxiety. In order to reduce anxiety, ego resorts to defense mechanism, way to reduce anxiety. These are the repression. When the person tries to be unacceptable urges and wishes to the unconscious mind, denial. When the person refuses to accept the reality, sublimation is there, projection and rationalization is there. Then the behavioral perspective, it holds that a primary cause of abnormal behavior is inappropriate learning, whereby maladaptive behavior are rewarded and adaptive behavior are not rewarded. The foundations of this perspective are Pavlov's classical conditioning and Skinner's operant conditioning. Learning permanent change in behavior due to practice and experience is the central theme of this perspective. So, focus is on how learning occurs. Cognitive perspective, it maintains that abnormal behavior originates from maladaptive ways of perceiving and thinking about oneself and the environment. Cognitions refer to person's thoughts, beliefs, and cognitive processes. It includes attention, selection, memory, perception, sensation, thinking, and planning. Cognitive psychologists, they study how people perceive, how they organize, how they retain and interpret information, and attribute the cause of abnormality to illogical thinking patterns. For example, a depressed person may make a mountain, my life depends on this exam. The interpersonal perspective, it views abnormal behavior as the product of disordered relationships. As we grow up, we tend to learn from our past experiences. However, some experiences are less useful. Such experiences may be deeply influenced by unpredictable and uncontrollable events in the childhood. They include early deprivation or trauma, inadequate parenting, marital discord or divorce, and maladaptive peer relationships. In a research by Johnson in 2000, children who are institutionalized at infancy or early childhood show maladaptive personality development, are at a risk of psychopathology. The sociocultural perspective, it views abnormal behavior as the product of broad social and cultural forces such as low socioeconomic status and unemployment, prejudice and discrimination in race, ethnicity and gender, social change and uncertainty, and urban stressors like violence and homelessness. For example, it has been found that socioeconomic class is inversely proportional to the incidence of mental disorder. For example, lower the socioeconomic class, the higher the incidence of mental disorders. It also examines the bases influencing diagnosis. The humanistic perspective, it asserts people are responsible for their own behavior, and if it is abnormal. According to the humanistic psychologists, people should be free to engage in whichever behavior they want as long as they do not cause distress to themselves and to others. The founders of this perspective are Carl Roger and Abraham Maslow. This perspective emphasizes on individuals' potentials and stresses, on the importance of growth and achieving self-actualization. This provided therapeutic techniques like Gestalt therapy and client-centered therapy for helping patients cope up with the problems of life. Classification and prevalence of mental disorders. Classification. Classification system provides us with a nomenclature and help us organize information in a more meaningful manner. Organizing information within a classification system also allows us to study the different disorders, their causes and treatment. International Statistical Institute at its meeting in Vienna in 1891, chaired by Bertolini, decided to prepare classification of causes of death, and which was adopted by many countries. In 1899, the American Public Health Association recommended Canada, Mexico and the United States to adopt it. The APHA recommended revision every 10 years to keep it up to date. The revisions that followed contained minor changes until the sixth revision of the classification system, which included morbidity and mortality conditions and changes in its title to International Statistical Classification of Disease, Injuries and Causes of Death. In 1948, the World Health Organization assumed responsibility for preparing and publishing the revisions to the ICD every 10 years. It is the most widely used diagnostic manual worldwide and is now in a 10th revision. According to WHO, ICD is the standard diagnostic tool for epidemiology, health management and clinical purposes. The 11th revision of the classification has already started and will continue till 2017. In the United States, the gold standard for defining various types of mental disorders is the Mental Psychiatric Association (APA) Diagnostic and Statistical Manual of Mental Health, commonly known as DSM, first published in 1952. The latest version published in 2013 is the DSM-5. The DSM system is multi-axial, that is, it allows an individual's mental state to be evaluated on 5 different axes. Axis 1, the presence or absence of most clinical syndromes including schizophrenia, mood disorder, anxiety, sexual and eating disorders. Axis 2, the presence or absence of stable long-term conditions including personality disorders and learning disabilities. Axis 3, relevant information on the individual's physical health. Axis 4, the psychosocial and environmental problems. Axis 5, rating of an individual's global level of functioning from a score of 1 for persistent violence, suicidal behavior or inability to maintain personal hygiene to 100, symptom free. The DSM-4 is used in US and is compatible with the ICD, so that DSM diagnose can be coded in the ICD system as well. Prevalence of mental disorders. In hospitals and clinics, we often say that a patient presents with a specific problem or a set of problems, or we discuss the presenting problem which indicates why the person came to the clinic. Presenting problem is the first step in determining clinical description, which represents a combination of behaviors, thoughts, feelings and a makeup of a specific disorder. An important function of the clinical description is to draw a line between the normal behavior and abnormal behavior. Various statistical data are collected. Some of them are as follows. Epidemiology is the study of distribution of disease, disorders or health related behavior in a given population. The term prevalence refers to the number of active cases in a population during any given period of time. Point prevalence, it refers to the estimated proportion of actual active cases of the disorder in a given population at a given instant in time. And period prevalence is the proportion of the population with a given disease or condition over a specific period of time. Lifetime prevalence is the number of individuals in a statistical population that at some point in their life up to the time of assessment have experienced a case, for example a disorder, compared to the total number of individuals. For example, it is expressed as a ratio or percentage. Incidence, it refers to the number of cases that occur over a given period of time. Other statistics include the sex ratio, that is what percentage of males and females have the disorder, and the typical age of onset, which often differs from the one disorder to another. Other disorders may have a time limited course, meaning the disorder will improve without treatment in a relatively short period. Closely related to differences in course of disorders are differences in onset. Some disorders have an acute onset, meaning that they begin suddenly. Others develop gradually over an extended period, which is sometimes called an insidious onset. Anticipated course of a diagnosis is called prognosis. So we might say prognosis is good, meaning the individual will probably recover, or the prognosis is guarded, meaning the probable outcome does not look good. The patient's age may be an important part of the clinical description. A specific psychological disorder occurring in childhood may present differently from the same disorder in adulthood or old age. We call the study of changes in behavior over time developmental psychology, and we refer to the study of changes in the abnormal behavior as developmental psychopathology. When you think of developmental psychology, you probably picture researchers studying the behavior of a children. However, we change throughout our lives. Researchers also study development in adolescents, adults, and older adults. Study of abnormal behavior across the entire age span is referred to as lifespan developmental psychopathology. The field is relatively new, but it expanding rapidly. Treatment. One of the most influencing factor in determining the treatment of abnormal behavior is the society's explanation of such behavior. If the deviant behavior is seen as resulting from possession by demons, then the treatment is provided by the means of potions, exorcism, and if it is assumed to be a result of neurological pathology, then it is handled by medical treatments like drugs, surgery. And if it is interpreted as resulting from psychological factors, then it is treated through psychological therapies. In some cases, people try to deny, minimize, and cope up with their problems. Even when they decide to seek help, they are often treated by family physicians rather than mental health scientists. Science of psychopathology, clinical and abnormal psychology. Clinical psychology and abnormal psychology are often used as synonyms. However, their differences can be identified in their definitions. Abnormal psychology is the scientific study of abnormal behavior and mental disorders in order to describe, predict, explain, and change abnormal patterns of functioning. Clinical psychology is the profession and academic discipline that is concerned with the application of psychological science to the assessment and treatment of mental disorders. For the years prior to 1890, there is really very little in the history of clinical psychology to separate it from the history of abnormal psychology. Therefore, abnormal psychology emphasizes on psychological science and research for the purpose of study of mental disorders. Researches in abnormal psychology include investigation of the causes and treatment of psychopathological conditions. Clinical psychology was derived and emerged from abnormal psychology, and it was formed as a practical discipline with focus on the study, assessment, treatment, and prevention of abnormal behavior. The purpose of clinical psychology is to train professionals in clinical practice to diagnose and treat mental illness and conditions. Clinical psychology has grown out of an academic research tradition. Clinical psychology emphasizes less on theoretic research but more on clinical practice. Psychopathology. Psychopathology is the scientific study of psychological disorders. Within this field are specially trained professionals including clinical and counseling psychologists, psychiatrists, psychiatric social workers, and psychiatric nurses, as well as the marriage and family therapists and mental health counselors. Clinical and counseling psychologists, they receive a degree, PhD degree, and conduct research into the cause and treatment of psychological disorders and to diagnose, assess, and treat these disorders. Psychiatrists, they hold MD degree in medical school and then specialize in psychiatry during residency training that lasts 3 to 4 years. Psychiatrists also investigate the nature and causes of psychological disorders from a biological point of view, make diagnose and offer treatments. Their choice of treatment is drugs and other biological treatments, but they often make use of psychosocial treatments. Psychiatric social workers, they have master's degree in social work. They experience in collecting information relevant to the social and family situation of the individual with a psychological disorder. They often treat disorders caused due to interpersonal and psychosocial factors. Psychiatric nurses are advanced degrees holders such as masters, doctors, and specialized in the care and treatment of patients with psychological disorders, usually in hospitals as a part of treatment team. Marriage and family therapists and mental health counselors are postgraduates employed in hospitals or clinics to provide clinical service under the supervision of a doctoral level clinicians. Summary: abnormal psychology is the scientific study of abnormal behavior in order to describe, predict, explain, and change abnormal patterns of functioning. The definition of abnormality has gone through many dramatic changes through history, demons, God, magic, body fluids, and wandering, and other influences, physical illness. Abnormal behavior can be defined as behavior that is deviant from social norms, causes subjective discomfort, does not allow normal day-to-day functioning, statistically rare, or causes the person to harm others of self. The manner in which we conceptualize the nature and cause of abnormal behavior has important implications for how we conceptualize treatment, the clinician's role and the client's role, and what we see and do not see in research and treatment. For example, possession definition logically leads to trafficking bodily fluids, and definition and logically leads to bleeding. DSM and ICD are standards for defining various types of mental disorders. DSM implies a category type of classification system similar to that used in medicines. Explanation of abnormal behavior also serves to indicate the specific type of suitable treatment.